So here we are going to visualize diagnosis of birth asphyxia first. For the diagnosis of birth asphyxia, so it's diagnosis of birth asphyxia, prematurity, and diagnosis of birth asphyxia, prematurity, and low birth weight. When you make a diagnosis first of birth asphyxia, your diagnosis is mild, moderate, or severe birth asphyxia. So you say mild, moderate, or severe birth asphyxia. So the classification of the birth asphyxia based on the ABDA score. After saying the classification of the birth asphyxia, you have to speak about the probable etiology of the birth asphyxia. Is the birth asphyxia coming as a result of an acute fetal distress that was seen intrapartum, or the birth asphyxia is coming from a fetal abnormality? Is it clear? And the fetal abnormality, you have to say which fetal abnormality. Is it a congenital heart disease? Is it a congenital heart disease? Is it a respiratory disorder like acute respiratory distress syndrome? Is it a meconial aspiration? So those are, is it a diaphragmatic herniation? So those are the different elements that you have to bring out as the etiology of the birth asphyxia. Now, after speaking about etiology of the birth asphyxia in your diagnosis, you speak about the complication of the birth asphyxia in your diagnosis, still based on the SHRDB algorithm. Is it clear? Speak about the complication of the birth asphyxia in the diagnosis. As complication of the birth asphyxia, it can be hypoxic ischemic encephalopathy, acute kidney injury. So all the complication, you have to evaluate it from your history. I have to speak about that. And you can also you may speak about the risk factor, and also may speak about the prognosis in your diagnosis. And the major prognosis, so you speak about the risk factor and the prognosis of the birth asphyxia in your diagnosis. After putting a diagnosis of birth asphyxia, you have a diagnosis of prematurity. Now, for the diagnosis of prematurity, what are the elements that you have to say here? Here you still say mild, moderate, or severe prematurity based on, or extreme, mild, moderate, severe, or extreme prematurity. So you have to speak about that. And when speaking about the mild, moderate based on the gestational age, you have to speak about the corrected gestational age, because that's a mechanism of the new corrected gestational age. After speaking, or you just speak about mild, moderate, or severe prematurity, you speak about the etiology of the prematurity. The etiology of the prematurity can identify a good risk factor for the prematurity. Is the mother going to have all the risk factor of preterm labor? Is she having a cervical incompetence? So all the, even a past history of prematurity can be a recent history of prematurity now. Is it clear? So all those are involved with the elements that can result to prematurity. Prematurity can be as a result of preterm labor, or everything that can result to preterm labor, or everything that can result to fragilization of the cervical membrane, like premature rupture of membrane. Is it clear? With an increase in intra-abdominal pressure and an increased fragilization of the lower part. Is it clear? So all those are the etiologies of prematurity. We can have preterm labor, we can have also premature rupture of membrane etiologies. Is it clear? Which can be associated with that. And you have also fetal abnormality associated with the prematurity. After speaking about etiology, speak about the complication that you have to identify for the prematurity. Similarly, for low birth weight, when you diagnose low birth weight, it is still very low birth weight, mild low birth weight, moderate low birth weight, and then you evaluate. So you have to speak about mild, moderate, very low birth weight. And when you speak about mild, moderate, very low birth weight, you have to evaluate that one. For mild, moderate, low birth weight, you have to see the classification. After speaking about the classification, you speak about the etiology of the low birth weight. Is the low birth weight coming from prematurity, or the low birth weight is coming from an intrauterine growth restriction? And you have to evaluate that from the intrauterine growth curves. After evaluating the intrauterine growth curves with the weight for the gestational age, you have other elements on the intrauterine growth curves, like the learn for gestational age and the head circumference for gestational age. If the weight for gestational age is small than 10%, it means that it's small for gestational age. But now that's small for a gestational age if there is learned for gestational age is not small. If the length for that gestational age is normal and the head circumference for that gestational age is normal, it means that the weight for gestational age is small, but the length and the head circumference for that gestational age is normal. It means that they are going to be asymmetric intrauterine growth restriction. Is it clear? That's how you call asymmetric intrauterine growth restriction. Is it clear? But if the weight for gestational age is small, the length for gestational age is small by less than 10 percentile, the height second for gestational age is small by less than 10 percentile, it's going to be called a symmetric intrauterine growth restriction. And you say if it is asymmetric or symmetric, and you have to speak about the etiology based on the asymmetric or symmetric. Are you getting all that? So those are the different elements that you have to speak about here. And now the next element you have so those are the different elements that you have to evaluate when you want to put a diagnosis. And then the next element is to say the complication of the low birth weight. Is it hypoxic ischemic encephalopathy? You have to speak about all the different complications of the low birth weight. Peculiarly, the complication that you have for prematurity and low birth weight are not going to be as much as, though there are the same complications like in the case of birth asphyxia. The complication of prematurity and low birth weight that you first have to manage, the first complication you have to manage is infection. You always need to know that these patients are going to be prone to infection. Second complication is hypothermia. You need to know that patients that are premature or low birth weight, they generally have hypothermia. Third complication, you have to evaluate for hypoxia. The patients that are low birth weight and premature, they can suffer for hypoxia. The fourth complication, you are going to have apnea bradypnea syndrome. They can also easily suffer from that. Apnea bradycardia syndrome. The fifth complication is anemia. The sixth complication is electrolyte imbalance. Is it clear? So these are the general complications that patients are going to suffer, and they can also suffer of hemorrhagic disease of the newborn. These are general complications that patients that are premature or low birth weight are going to suffer, and they can also suffer for the number 8 complication, which is failure to thrive. So in the management protocol of patients that are premature and low birth weight, these are always going to be taken in consideration. Is it clear? So those are the different elements that you have to put in mind. Now, as an aside, I want to speak about high birth weight.